What's up, YouTube? I'm here with another video. This is my lung cancer acute respiratory distress review. I'm just going to dive into it. What are 4 factors we discussed when diagnosing acute respiratory distress disorder? PCWP, pulmonary capillary wedge pressure, a measurement of pressure in your heart less than 18 mmHg. A PF ratio, PaO2 to FiO2 ratio of less than 300. Bilateral infiltrates, an acute quick onset. What are 4 factors we discussed when diagnosing ARDS, acute respiratory distress syndrome? PCWP, pulmonary capillary wedge pressure, a measurement of pressure in your heart less than 18 mmHg. PF ratio of less than 300. Factors when diagnosing ARDS, bilateral infiltrates, acute quick onset as well. PCWP, pulmonary capillary wedge pressure, a measurement of pressure in your heart less than 18 mmHg. Bilateral infiltrates, acute quick onset, and a PF ratio of less than 300. What are 3 descriptors for ARDS on lung chest x-ray, and why do they present like that? Ground glass, honeycomb, and reticulogranular. And because of increasing fibrosis in your lung tissue. What are descriptors of ARDS on a lung chest x-ray? Ground glass, honeycomb, and reticulogranular. Why do they present like that? Because of the increasing fibrosis in your lung tissue. 2 examples of indirect cause of ARDS: pancreatitis and sepsis, which is the most common example of indirect cause of ARDS. Sepsis is the most common indirect cause of ARDS. Name 2 examples of indirect causes of ARDS: pancreatitis and sepsis. Sepsis is the most common. 2 examples of direct cause of ARDS: thermal lung injury, lung contusion, near drowning, pneumonia, aspiration, severe trauma, drug abuse. Name examples of direct cause of ARDS: thermal lung injury, lung contusion, near drowning, pneumonia, aspiration, severe trauma, as well as drug abuse. What's the PF ratio for a patient on room air who has a PaO2 of 60? Does that classify as ARDS? PaO2 divided by FiO2 room air would be 21%, equals 286, which is less than 300, so that would classify as acute respiratory distress syndrome. What is the PF ratio of a patient with a PaO2 of 80 while on a ventilator at 95% FiO2? Does that classify as ARDS? 80 divided by 95 equals 0.84 times 100 equals 84, which is less than 100. That equals, which means that they have severe ARDS. Mild ARDS is a PF ratio of 2 to 300. Mild ARDS PF ratio of 2 to 300. Moderate ARDS is a PF ratio of 1 to 200. Moderate ARDS is a PF ratio of 100 to 200. Severe ARDS, acute respiratory distress syndrome, is a PaO2 divided by FiO2 ratio, which equals less than 100. Severe ARDS is a PF ratio of less than 100. ARDS presents with dyspnea, cyanosis, bilateral crackles, tachypnea, trachycardia, diaphoresis, which is sweating, use of accessory inspiration. ARDS presents with dyspnea, cyanosis, bilateral crackles, tachypnea, trachycardia, diaphoresis, use of accessory muscles. Interstitial. Major pathological or structural changes with ARDS. Appearance of lungs are heavy, red, beefy, or liver-like. Interstitial and alveolar edema and hemorrhage. Alveolar consolidation. Intra-alveolar hyaline membrane formation. Pulmonary surfactant deficiency, qualitative abnormality, and atelectasis. ARDS, non-cardiogenic, non-hydrostatic pulmonary edema, is ARDS, acute respiratory distress syndrome. Commonality of true ARDS is the destruction of the alveolar capillary membrane. Lungs become fibrotic, restrictive lung disorder. Risk factors of lung cancer. Which is the number one risk factor of lung cancer? Cigarette smoke. What is the number one risk factor for lung cancer? Cigarette smoke. Which type of lung cancer is most strongly correlated to cigarette smoke? Small oat cell carcinoma. What is the number one risk factor for lung cancer? Cigarette smoke. Which type of lung cancer is most strongly correlated to that risk factor? Small oat cell carcinoma. Before I dive into lung cancer, I wanted to hit this real quick. Lung cancer is an abnormal growth, multiplication of new tissues. Clinical terms for lung cancer is neoplasm, tumor, and carcinoma. Clinical terms for lung cancer is neoplasm, tumor, and carcinoma. All right, now back to this. What are other risk factors for developing lung cancer? Radon, second most common factor for lung cancer behind smoking, and occupational hazards such as asbestos and uranium. What are other risk factors for developing lung cancer? Radon is the second most common cause of lung cancer, and occupational hazards such as asbestos and uranium. Radon, asbestos, and uranium also cause lung cancer. What is a risk factor? Let me hit that again. Radon, asbestos, and uranium are also causes of lung cancer. What is a risk factor when it is no longer an option to surgically remove a tumor? When the cancer has invaded other vital organs. What is a risk factor when it is no longer an option to surgically remove a tumor? When the cancer has invaded other vital organs. What type of cancer is most associated with non-smokers? Adenocarcinoma. What type of cancer is most associated with non-smokers? Adenocarcinoma. Defining cancer terms. What is radon? Radon is a radioactive gas that is known as a carcinogen. It's the second most common cause of lung cancer after smoking. What is radon? Radon is a radioactive gas that is known as a carcinogen. It's the second most common factor of lung cancer after smoking. List as many terms for lung cancer as you can. Tumor, neoplasm, and carcinoma. List as many terms for lung cancer as you can. Tumor, neoplasm, and carcinoma. List as many terms for cancer as you can. Tumor, neoplasm, and carcinoma. Define cancer. Abnormal growth, a multiplication of new cells. Define cancer. Abnormal growth, a multiplication of new cells. Traits of a tumor: if it is benign, organized, localized, slow growing. Traits of a tumor: if it is benign, organized, localized, and slow growing. What is a potential hazard of a benign tumor? The growth pushing on or impeding organs around it. What is a potential hazard of a benign tumor? The growth pushing on or impeding organs around it is a hazard of benign tumors. What are traits of malignant tumors? Malignant tumors are cancers. They also grow in a disorganized manner, and they invade surrounding tissues. Traits of malignant tumors: cancers. They grow in a disorganized manner and invade surrounding tissues. What is metastasis? Cancer traveling to different location of the body. What is metastasis? Cancer traveling to different location in the body. If I could go back and hit this again. Diaphoresis is sweating. So people with ARDS have dyspnea, cyanosis, bilateral crackles, tachypnea, trachycardia, diaphoresis, which is sweating. Use of accessory muscles. All right, back to lung cancer. Metastasis, cancer traveling to different location in the body. Stages of lung cancer. 0. This is large cell lung cancer. Is rated 1, 2, 3, 4, and then 4B and 5. Small cell lung cancer is staged differently than non-small cell. Stage limited or extensive. So small lung cancer is rated limited or extensive. Limited, the cancer is non-confined to only one lung and its neighboring lymph nodes. Extensive, the cancer has spread from one lung to both lungs, has invaded more remote lymph nodes or metastasis. So large cell lung cancers. 0 is limited, the lining of lung with no involvement of lung tissues or metastasis. Number 1 is less than 3 centimeters, is located in lobar distal airways, no lung tissue involvement or distal metastasis. Number 2, rating of large cell lung cancer. Has invaded neighboring lymph nodes or spread to the chest wall, no distant metastasis. Number 3, rating for large cell lung cancers. A tumor of any size. Tumor is accompanied by atelectasis or obstructed pneumonitis of the entire lung. Local invasion involves chest wall, diaphragm, mediastinal, pleural, parietal, pericardium. No presence of metastasis. 4B, there may be involvement of any lymph node groups with no distant metastasis. And 5, cancer of any size, it involves any of the lymph node groups and has spread to other parts of the body. I'm only going to hit that once, but I will review some of it here. What stage of lung cancer is limited to the lining of the lung with no involvement of lung tissue? 0. What stage of lung cancer is limited to the lining of the lung with no involvement of lung tissue? 0. What stage of cancer is cancer of any size involving any lymph node groups and has spread to other regions of the body? 4. What stage of cancer is cancer of any size involving any lymph node groups and has spread to any other regions of the body? 4. What stage of cancer is a tumor of any size that is accompanied by atelectasis or obstructive pneumonitis of the entire lung, has local invasion involving chest wall, diaphragm, mediastinal, pleural, or parietal pericardium? No metastasis. Stage 3 cancer. What stage of cancer is a tumor of any size that is accompanied by atelectasis or obstructive pneumonitis of the entire lung, has local invasion involving chest wall, diaphragm, mediastinal, pleural, or parietal pericardium? No metastasis. Stage 3 cancer. What stage of cancer may be involved any lymph node group with no metastasis? 3B. What stage of cancer may involve any lymph node group with no metastasis? 3B. Onto the miscellaneous. How would you define ARDS? What is true of all ARDS? How would you define ARDS? Non-cardiogenic pulmonary edema. How would you define ARDS? Non-cardiogenic pulmonary edema. What is true of all ARDS? Destruction of alveolar capillary membrane. What is true of all ARDS? Destruction of alveolar capillary membrane. What type of cancer is located near a large bronchi and may protrude into the airway? Squamous cell carcinoma. What type of cancer is located near a large bronchi and may protrude into the airway? Squamous epidermoid cell carcinoma. What are some clinical symptoms of lung cancer? Non-productive cough, hemoptysis, just coughing up blood, chest pain, dyspnea, any other local effect the tumor may have due to location. What are some clinical symptoms of LCA? Non-productive cough, hemoptysis, coughing up blood, chest pain, dyspnea, and any other local effect the tumor may have due to location. What does refractory hypoxemia mean? What is refractory hypoxemia means hypoxemia that doesn't improve with increased FiO2. Refractory hypoxemia is hypoxemia that doesn't improve with increased FiO2. What is our answer to refractory hypoxemia? Increasing the PEEP, positive end expiratory pressure, to recruit more alveoli. What is our answer to refractory hypoxemia? Increasing the positive expiratory pressure to recruit more alveoli. List 3 tools for diagnosing lung cancer: bronchoscopy, chest x-ray, and histologic examination. List 3 tools for diagnosing lung cancer: bronchoscopy, chest x-ray, and histologic examination. In patients with ARDS, what are some tools or techniques we have to improve their oxygenation? Inhaled nitric oxide cause pulmonary vasodilation, therefore improving oxygenation. We can also perform ECMO, to perform oxygenation outside their body. Extracorporeal oxygenation. We can also do prone positioning to treat ARDS. That is when we lay the patient on their stomach to increase oxygenation. In a patient with acute respiratory distress syndrome, what are some tools or techniques we have to improve their oxygenation? Inhaled nitric oxide, ECMO, and prone positioning. Inhaled nitric oxide causes vasodilation, therefore improving their oxygenation. ECMO, to perform oxygenation outside their body. Extracorporeal oxygenation. Prone positioning. Lay the patient on their stomach to increase oxygenation. Which form of lung cancer has the worst prognosis and why? Small cell lung cancer, carcinoma, is the worst prognosis because it's the fastest growing, doubling in size every 30 days. Which form of lung cancer has the worst prognosis and why? Small cell lung cancer, carcinoma, has the worst prognosis because it's the fastest growing, doubling in size every 30 days. Acute respiratory distress syndrome, fibrotic. Management of acute respiratory distress syndrome: corticosteroids given IV, ventilator, higher PEEP, lower volumes, tidal volumes, higher respiratory rate, pit pressure between 25 and 30 cm H2O, PaO2 55 to 80, or stats 88 to 95. Inhaled nitric oxide, extracorporeal membrane oxygenation, ECMO, oxygenation from and prone ventilation, patient laying on their stomach. That's how we treat ARDS. Lung cancer: abnormal growth, multiplication of new cells. Clinical terms for lung cancer: neoplasm, tumor, and carcinoma. Benign, not life-threatening unless interferes with organ, does not invade cells, slow growth, localized, push aside normal tissues. Malignant tumors grow, disorganize, nutrition of cells compromised, necrosis, ulceration, cavity formation, metastatic, transported to new bodily locations. Atelectasis, alveolar consolidation, Causes of lung cancer: cigarettes is the #1 cause of lung cancer. Radon is the second most common cause of lung cancer, as well as asbestos and uranium. Non-small cell lung cancer: squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. Non-small cell lung cancers are squamous, so these are large cell lung cancers. Squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. Small cell carcinoma is a small cell lung cancer. It originates from K-type cells in bronchial epithelium, correlated with cigarette smoking, fastest growing. Worst prognosis: doubles every 30 days. Small lung cancer found in hilar region, oat cell carcinoma. Has early metastasis. Squamous cell carcinoma, which is non-small cell lung cancer. Squamous carcinoma is most common in men, forms in the hilar region. Late metastatic tendency, doubles every 100 days and protrudes into bronchi. Squamous cell carcinoma protrude into bronchi. Adenocarcinoma is the most common, is also a non-small cell lung cancer. Adenocarcinoma is the most common in women and people who don't smoke. Originates in mucus glands. Moderate metastasis, so it's slow spreading, or not as fast spreading. Secondary cavity formation. Large cell carcinoma, early metastasis, doubling 100 days, and has cavity formation. Management of lung cancer: surgery, bronchoscopy, radiation therapy, and chemotherapy. Pneumonectomy, removal of entire lung. Lobectomy, entire removal of entire section of lobe. A segmentectomy, wedge resection, is a removal of part of the lung. Sleeve resection is shortened airway removal. You cut above and below and reattach. Video-assisted thoracic surgery. Early cancer in pleura is used on early cancer in pleura. Staging of small cell carcinoma. Limited, confined to one lung, neighboring lymph nodes. Extensive and extensive. Limited and extensive are staging of small cell carcinoma. Limited is confined to one lung, neighboring lymph nodes. Extensive is the spread metastatic beyond one lung into more remote lymph nodes. I want to hit this again. Lung cancer staging. This is for non-small cell lung cancer. What stage of cancer is limited to lining of the lung with no involvement of lung tissue? Stage 0 lung cancer. What stage of cancer is of any size involving any lymph node groups and has spread to other regions of the body? Stage 4 cancer. What stage of cancer is a tumor of any size that is accompanied by atelectasis or obstructive pneumonitis of the entire lung, has local invasion involving chest wall, diaphragm, mediastinal, pleural, or parietal pericardium with no metastasis? Stage 3 lung cancer. What stage of cancer may involve any lymph node groups with no metastasis? 3B stage cancer. Peace.